Good afternoon, everybody. We're going to go ahead and start with our land acknowledgement. Do we have a volunteer to read our land acknowledgement?
Stacy was going to read our land acknowledgement today.
Oh, fantastic.
I told you last time, Brad, I wasn't ready, but I'd do it this time. I didn't forget.
Good. Thanks.
Okay, let me know when you're ready. Ready?
Anytime.
Okay. We recognize and acknowledge the indigenous land on which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Tenino, Klamath, Malola, and Yahuskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guest honoring and the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children.
Thanks, Stacy. As far as meeting practices, we are just want to make everybody aware that we are doing our best to make these meetings welcoming, and that mostly means using plain language, doing our best not to use a bunch of acronyms, and yeah, just speak in ways that we would speak to folks who aren't in this health realm, which includes many of us. And also we want to make sure everybody feels welcome participating, speaking up, using the chat, communicating, expressing yourself. And I ask all of us to be aware if it seems like some of our CAC members are not participating. I mean, you're obviously welcome to not speak, but that's part of feeling welcome, right? But we also want to kind of proactively reach out and see if our CAC members have something to say. And so anybody can do, I welcome anybody to do that if you're kind of noticing that it'd be a good idea to call in a couple members just to see if they want to say something or not. Give them the opportunity, please do. And we do our introductions only for the CAC members, and everybody else, please introduce yourself in the chat. That's just a time-saving thing because we're always short on time. And so let's get started with introductions. Kelly, do you want to help?
Yeah. Brad, do you want to go first?
Sure. I'm Brad Porterfield. I'm the chair of the Community Advisory Council and also a board member on the Health Council, and happen to be a consumer member first. My son is OHP, has OHP. And I also happen to be the director of the Latino Community Association.
Next, let's do Elizabeth and Mandy.
Hi, I'm Elizabeth Schmidt. I'm the vice chair of the CAC. And well, that's it. Thanks.
Hi everyone, Mandy Seeley. I use she, they pronouns, and I'm a CAC consumer rep out of Sisters.
We'll go with Stacy, then Connor.
I am Stacy Shaw, she, her, hers. I am a consumer rep and a Clark County rep.
Hey everyone, this is Connor Carlson. I am a consumer rep and work for the Family Resource Center of Central Oregon.
Elaine, then Teresa.
Elaine C. Schultz, she, her, hers, community member, CAC member, and with Mosaic Director of Strategy and Development.
I'm Teresa. You guys ready for me?
Yeah, go ahead.
Okay, I'm Teresa Olander. I'm a community rep in the CAC.
And next we have Tom and then Linda.
Hi, Tom Kuhn, he, him, his. I'm a CAC member and the Deschutes County representative.
And I'm Linda Johnson. I'm on the Health Council Board as a community representative, but also CAC member. Thanks.
Great. I believe I got all our CAC members, yes? We do have one guest here today that is new. Danny, would you like to introduce yourself?
Yeah, thank you so much for the opportunity. My name is Danny Stribling. I'm from Connect Oregon. I'm a community engagement manager with Connect Oregon. And I'm here today. I recently had the opportunity to work in Central Oregon, and I'm here today to learn more about the community, see where health and community-based organizations intersect, and really just, I really want to, again, learn from the folks who are doing the work and see where Connect Oregon might be able to help in the future. But really, my main purpose here is just to learn from you all about your community, and that's it. So thank you again for the opportunity, for the introduction.
Great. Thanks, Danny. And yeah, everybody else, we should be good.
Thanks, Kelly, and welcome, Danny. So yeah, everybody else, just in case people joined after I said this, please introduce yourself in the chat. And with that, we will open up for public comment. Is there any public comment? Anyone who would like to make public comment, share information?
I learned something.
Teresa.
Over the years, I'm learning things about the process. And what I've learned is when you request a service and it's denied, it's based on an algorithm, which I kind of figured, and I figured stuff was just denied. And I knew there was an appeals process, but that takes a long time. But that's where they look at you as an individual. If you appeal the denial of a service provided, you get looked at as a person instead of a algorithm looks at you. Anyway, so if you really feel like you need the service, I guess it's worth jumping those hoops for.
Thanks, Teresa. I think that's good advice.
I also say I also hear from our Mosaic providers that they help with that. So make sure if you can engage your provider also to partner with you in those discussions as much as possible. That also helps.
But you have to be a Mosaic.
Right. So it'd be your own primary care provider, for example.
Right.
Yeah, thanks, Teresa and Elaine. I also had that experience myself with a provider. It was pretty helpful. We still weren't successful, but provider was helpful in advocating through that appeal process. Any other public comment? All righty. Let's, I guess we're gonna talk about, among us all, how we're feeling as far as meeting in person versus hybrid. Let's just open that up. So that, again, for the Community Advisory Council, are you wanting to meet in person at our next meeting? Are you wanting to meet in person more often? Do you prefer virtual? Are we want to move forward with essentially a hybrid approach? Well, I think all of our meetings, if I'm not mistaken, is as long as we have the technology, are going to be hybrid in the sense that if we are in person, we'll also have Zoom, as long as we have the technology. But then also thinking about throughout the year, a hybrid approach being meet in person sometimes, meet virtually sometimes. What are your thoughts?
I would think that a hybrid approach would be great right now. And also with winter coming up around the corner, if it's bad weather conditions, we could just go to Zoom only when that does occur. So I think hybrid gives us some flexibility.
And Tom, just to clarify, are you, so you're saying in person and Zoom or virtual?
I think initially in person and Zoom, like schedule all the meetings with kind of an either or, and then maybe we could transition to in person only, or could do like a every other month in person or Zoom. Because let's face it, the amount of time you save by not having to travel with meetings is, we've found out, is pretty significant. So I think having some sort of a hybrid approach, I'm not exactly sure, I think that would be the best route to go.
Thanks, Tom. Anybody else?
I think you should always have Zoom because it opens up for people that can't travel or for whatever reason. You know, it just allows them to be there. If they had to show up, it may not be doable for them. But I also think there's a lot of value in actually seeing more than 2 people at a time. Well, I get to see 6. So.
Thanks, Teresa. And I think Stacy, yeah, your mic went off or on.
I was wondering too if kind of like how the Chamber of Commerce does it, where they have like a different hosting place in each business. You know, I just was where Tom works and they have a nice meeting room. It would be kind of cool if even some of us who could host these meetings, weather permitted, be able to do that so that other people on the CAC could maybe even come see where we sit sometimes. Just as a thought. Because I know in Kirk County, I'm sure I could talk Katie into letting us use one of the meeting rooms. And
Stacey,
learning how to use the stuff.
Yeah, do you have that technology to be able to have Zoom as well?
We share a building with Mosaic and they just got a new fancy thing. They said they would be happy to let us use it. We just need to let them know. But even in the building I work in and across the street, it's not as fancy, but we do have the speakers and stuff like that. But yeah, just as an idea.
Okay.
Brad, I'm sort of interested. I see the value in in-person meetings, and I'm concerned about even the cost of sending staff to a remote location or having our board members have to go through the expense of high gas prices to drive somewhere. So what I would suggest would be maybe quarterly in-person meetings in different locations. And then the other 2 meetings of the quarter, you'd just be by Zoom.
Yeah, I think that's a model we have that has come up once or twice before. What do people think about that model? Because that seems like a happy medium. Like an in-person meeting once a quarter, so 4 in-person meetings a year, maybe 5 if we do the combined CAC board meeting in person, and the rest only virtual.
Well, I don't have a car because it was totaled in my car accident 15 months ago. I have no immunity. I'm 70. I really am not going to meet in person. So I'm going to be on Zoom if possible.
Okay. Yes,
So-
the in-person, we would always make sure that we could do Zoom as well.
So here's a follow-up comment for me about in person. I went to some meeting yesterday by a fluke and it was in person, but it felt more personal. So I just got a message in the chat and I don't even know who it's from, partly because I can't read it, that somebody, Mandy and somebody else thought it was a private message, thought they saw me at the Seed to Table fundraiser on Saturday. And I was there and it was me. And point being is, and I saw Gwen one day in the store, and because we have so little interaction, I didn't know who she was until she introduced herself. So I think you get to know people better in person. And this is my proof. Yeah, I was there.
Doppelganger. Yeah, I agree. I think we actually need to meet in person. I mean, those who can, those who choose to meet in person at least quarterly and share a meal and have that different kind of interaction. Again, for those who can and who choose to. Was there anybody who's opposed to that plan? All right, staff, does that sound good? Yeah, cool. All right, and we will try to move around the region because it is, well, we need to move around the region. We're a tri-county effort, so. All right, and yeah, I guess if you know of facilities, especially in the other counties, so Stacy, you mentioned Prineville, Tom's in Deschutes County. We don't really need another location in Deschutes County, although we could consider it, I guess. but-
Jefferson has a nice new building. I
I
meet with
mean-
Mike tomorrow. Could,
And their
you
brand
know,
new building, that's right. Yeah,
yeah, it's huge. It's nice. Just saying.
Yeah. no, you're right. They have like state-of-the-art technology there too, in that room.
Mhm.
If you want, I can get, it's a Jeffco Mosaic building. So I could book that and I can book the Trick County Mosaic building in Pineville. So let me know.
Excellent. All right. All right, thanks, everybody. Our last order of business before we get into discussion, more discussions, is making sure everybody agrees that the meeting notes from our last meeting in August accurately reflect what happened. Is there anyone who sees a problem with the notes? Something either not included or incorrect? Okay, we're gonna take that approach. So notes look good. Thanks, everyone. And now, small group breakout sessions. What's our, Kelly, are you in charge of that? What do you do?
Yes, sorry, I couldn't find the mute button. Yeah, so today, maybe a little more serious question. What do you do to support your mental health? You'll have about 10 minutes or so to discuss, and I will send you to your breakout rooms right now.
Well, I hope that was as awesome for all of you as it was for me. I think we actually, can you hear me? Hello?
We can hear you. We can hear you.
Okay, seems like everybody's frozen on my screen except for me. Okay, I think what we just did is part of our mental health, at least for me. What we're doing in our meeting, spending this 8 or 10 minutes, however long that was, together is really good for our mental health. I don't know what you think, but good stuff. All right, well, let's move on to community health projects with Michaela.
Thank you. So today, you should all be in the middle of reviewing the pre-applications. And so today I just wanted to go over the process again with everyone, the updated timeline, and have a few minutes to some Q&A. All right, so I'm going to show the updated timeline. And this information should not be new to you. It was in an email, I think at the end of August, and should have came with the pre-applications. But as you know, we received 73 pre-applications, which is exciting, and also a big task to review all of those. So we adjusted our process. And so instead of the review for the pre-applications being due this month, we extended that to October. So your scores for the pre-applications are due October 17th. And so it gives you extended the review time for those pre-applications. And so you have about a little over a month left to get in those scores for the pre-applications. And then at the October 20th CAC meeting, is when you'll be making your final funding decisions based on that 1.9 million. And right after that meeting, we'll notify the applicants of the award, but they'll still need to fill out that full application. So providing project outcomes, providing any MOUs that they may need to have in place if they're working with the tribes, just those kind of extra details for the application. They need to have those in by the end of November for them to be funded. And then we'll provide those funds to the applicants in December. For the review process, we broke you into 3 groups. So each group should have 4 CAC members, and we're sending out batches of pre-applications in sets of 10. And then we ask, once you submit the scores for your batch of 10 applications, let Kelly know, and then she'll give you a new batch to review. And we really want all CAC members to review at least 3 batches. So that's 30 applications. For incentives and thank yous, because we know it's such a huge lift, for consumer representatives, each batch that you review and provide the scores for, you can receive a $45 stipend or gift card. And if you review all 73 pre-applications and submit scores for those, you can receive an additional $200 stipend or gift card. And that's optional. You don't have to take those, and just be aware how that may impact your taxes and your income eligibility for OHP. So just be aware of that. And then for the community members on the CAC and the county representatives, for each batch that you review and submit scores, we'll provide a $10 gift card. And you'll also be eligible for that $200 bonus gift card for reviewing all 73. And let us know. I know different organizations have different limits to what you can accept. So just let us know. Any questions on the process? So
I just was wondering, I know you said to send it out like by increments of 10, but I was hoping to, if I could get the last 23 to do over the weekend and on Monday, because Monday's my day off. Like, is that an issue?
So there are a few applications that we're taking a little closer look at just to make sure that they have that they meet the qualification and they have like the correct or the appropriate relationships in place if they're working with the tribes. And so we'll be able to give you what we can.
Okay, I was just wondering, just because I have a timeline for myself, and Monday at 1 a.m. is probably my cutoff for.
Okay.
Yeah, just because school starts Tuesday. So I'm like, okay, I have until Monday 1 a.m., which is Tuesday. But yeah, I was just wondering if that was okay.
Are you talking about this weekend?
Yeah.
I don't think we'll be able to give you all of them by this weekend, but let's
just whatever I could get.
Yes, we'll do that.
Okay. Cool.
And I don't have a question about this process. It seems pretty clear. And I'm getting ready to go out of town for 3 weeks, but I will be at the next meeting on the 20th. And what I'd like to ask Brad and staff is whether we could create some discussion at that point after we've made the decision of what to move forward with. Just a review of what the process was like for people. I'm coming from a place of remembering the discussion last week with the Health Council Board, where Brad and I and others made it clear what a heavy lift this is for CAC to review applications and be in a grant and grant approval process. It's something that a lot of us have never done before. And I understand the intention of OHA for wanting these to be approved through CAC. But I'm feeling like personally, there wasn't enough preparation or training to equip us to better do it. So I'd like some feedback from people, how the process went, what could have made it go better so that we can communicate that back to the board and back to OHA as a way of advocating for future approval projects.
Yeah, I think after this, this process, we'll need to have that conversation and what that looks like and what the requirements are of the CAC in approving these funds and what, you know, how it could look different next time. So it's not a big lift, and, you know, what are the CAC priorities and what they want to and what you all want to spend your time on during the meetings.
I have a clarifying question. Wasn't one of the requirements for these projects to serve people on OHP?
Yes.
Okay, because I have seen a couple that have either said no or unsure. So I just wanted to verify that. And Linda, for a little feedback, I was nervous about taking this on because I'm in 3 different groups that are reviewing grants right now. And I did 28 for a group right before I got the first 10 from the CAC. And it took anywhere from 30 minutes to an hour per application. So when I got these, it was like a breath of fresh air for me personally. But that's just me. And I have a little experience doing it, so.
Thanks, Mandy.
Yeah, I develop like my own process. And like I was telling Kelly, I usually do schoolwork outside of my job. And so this is helping me prep and get into my own routine and kind of discipline myself again. But for me, there are some applications where I just put on there, like, I need to talk to somebody about this. I'm not sure. And then there's some where I try to put like, I know this organization, I know this person, just to be transparent. I can talk on this, or I can speak about this if anybody had questions. But otherwise, my process is reading them all and then going back through and actually scoring them individually. It takes me about 5 hours straight to do all 10.
It's a lot of time.
I'm wondering if that would be helpful information, and we might even want to collectively as a CAC feedback our experience to OHA. What worked, how much time it took, what didn't work, what were the challenges that we faced along the way or in preparing ourselves, what we wish we had known before we started, that kind of stuff.
Yeah, I think some of it too, just to add, is this is reading grants is not my job, not my what I've studied, what I'm familiar with on a day-to-day basis. And so it is helpful that I do work in like a smaller community, and I've talked to a lot of these organizations that applied and just understanding their bandwidth. And so even if we could have a consultant come in and help guide us as, you know, consumers or community or county reps, and like, you know, when reading these grants, it's not who wrote it the best way. It's like being able to understand where the need is and like the qualifications, opposed to like, oh, this is just kind of like they're not a strong writer, if that makes sense. Because there are some grants that I know them, and the way it comes across, I'm like, oh boy, this sounds really bad, but I know their organization and I've seen it, and it's just not coming through on paper. Even though I know that the COHC does offer grant assistance, like grant writing assistance, it's still not the same because we're reviewing it and we need kind of some assistance, if that makes any sense.
Yeah, it does. Being able to kind of distinguish what the writing skill, ability, grant writing versus like what the project is really about. Okay, yeah, we can, let's plan to have a review of this process November, December of this year. And then we can start kind of designing what we want the next process to look like, and hopefully it'll be a lighter lift.
I've discussed with Michaela and Gwen that they talk about underserved population or ACEs population or the people in a rural community, but they don't specify like we have Spanish or we have people from Warm Springs, or only 3 or 4 grant requests talked about working with the Spanish population. And I find that hard because I thought that was important to specify. You see, this is my 3rd year.
Yeah, that health equity component.
Yes.
All right, so I think we're running out of time. I do want to, I know it takes a long time to review all these applications. This is kind of the progress that you all have made towards reviewing. So we still have 2 batches that haven't been sent out for review yet. And there are also 6 people that haven't started their review of the batches. And we have 4 weeks left, and we're asking folks to review at least 3 batches. Kelly, do you want to share a little bit about this visual?
Yeah, so as the scores are coming in, I'm sort of keeping tally on which batches have been reviewed to make sure we're getting as many reviews for each batch as possible. And we'll have, so F and G, most people haven't gotten to those ones yet, but we're still preparing those to get out so that everybody has the appropriate information. Everybody, each group is on a different schedule of which batches they'll get first. So it may be mixed up a little bit. So don't be concerned if you haven't gotten A yet. Yeah, and if anybody needs any assistance that we can help with, please reach out because we are here to help you with that, to support you.
Hey,
Does anybody have
Kelly?
Yeah.
Yeah, I have a question. So reading this graph, am I reading it correct to say like batch E has had 2 people review the grants in batch E?
No, batch E, that's only 1 person.
Okay. And then batch B, as in boy, has had 4 people review it.
Correct. Yes.
Okay. Thanks.
Are you doing them in the same order for everyone?
No, everybody's got a different order. Any other questions?
I'm curious, are we gonna have like a meeting where we can all kind of discuss them, or I don't know if that makes sense. Like if there's, I know some of them, I can't remember who mentioned it, like, oh, this is for OHP patients, and it said no or unsure. Like, I'm wondering if one of those applications was like from Crook, but basically if anybody had questions about the Crook County ones, because I've met with a lot of these organizations and I've gone to their like meetings, if there's anything that I can help clear up, I'm happy to do so. If we're not gonna meet, just putting that out there.
Well, the reviews are due on the 17th. Once that day has come, I'm going to compile all of the reviews for each of the applications and include any comments, notes, concerns that people had. And I'll get those put together and be ready for the 20th for our monthly meeting.
So the 20th we'll spend the majority, the bulk of that meeting all on this, because that's our priority. For our regional health improvement plan work groups, we've like started a string on like an email for folks to respond to. I don't know, does anyone have suggestions of ways to communicate or connect around different reapplications?
So something that the other group that I'm working with did was we all scored everything and then we got together in person to talk about them. I know we just had this conversation and it may not be good for October, but being able to sit in a group and have everybody, you know, discuss what any concerns or something that they noticed that others might not have noticed, that was really helpful in that setting.
I think we have an hour on the 20th, which is
I
not,
think
it's not a lot of time.
one of the things that would be helpful for me is, and I think I might have done it on one application in my first group, which is if I have a specific area of concern or I want to explain why I gave one application a lower rating than another, or if I have a major question about it, I enter it into the notes section of the survey. And if we can compile any comments that were written on the notes section by the application, that's one way to start to, in advance of the meeting on the 20th, understand what other concerns other people have had around a specific grant.
Mm-hmm.
It's not live and interactive, but it's at least gives us a way to sort of put a parking lot note on it so that we can come back and answer it.
Yeah, we'll be able to share comments, and then I'm also wondering if we could put like the aggregated scores and comment onto like a Google sheet where everyone has access to them, or I don't know. We can think of ways offline to be able to share those comments and feedback as we go along.
I have one more thing. In the spreadsheet for the other group I'm in, and I don't know if this would work for this particular group, but we have 3 different tiers. So there's the ones that we definitely don't want to fund, and then there's the ones we definitely do want to fund, and then there's like a tier 2 or wait list or something if for whatever reason, you know, they get funded by someone else and you can go to the next one. So I don't know if that will work, but if we could start with the ones that we know we don't want to fund for whatever reason, that would knock some of them out of the way to then narrow down the other ones.
Yeah.
How much more money are there in applications than we have?
So about half. So you have you can fund about half of them. And so I think that's a smart idea to have some kind of backup applications, especially since you're approving pre-applications.
So we have over 3 million in asks.
Over 4 million in asks.
Over 4 million. Okay.
About 4, and then 2 million funds.
Okay, well, we do need to move on to our next item. If there's anything that needs to be said now, go for it. We got 1 more minute, but otherwise we should. Everything you need, Michaela?
I did. Thank you, everyone.
Just a quick question.
Yeah.
Given the volume of cash and how quickly it's going through the committee and the small number of committee members to review, given the applications, is there any need to have a conflict of interest if one of us, for example, our uncle works for some, or a child works for an organization, that we would need to declare that?
Yeah, we'll need to have conflict of interest in place. And we can start out with the conflict before we go into that decision making.
So we'll ask CAC members to just self-declare at that November meeting. Is that what you're thinking? if there's any, yeah, like if you're on the board or something, some kind of conflict, or you feel like it's a conflict, maybe it's not, but you're not sure.
I
Okay.
like Mandy's suggestion she just made. She put her conflicts in the comments section of the survey.
Good idea.
I remember the first round of CBI applications, Mosaic had an application in, and Elaine sort of declared that she wouldn't weigh in on that application. And yeah, that seemed to work well. It's very transparent.
All right. Well, so yeah, use the notes section, but we will also bring it up in the November meeting in case someone didn't use the notes section, to be transparent. Thanks, Kristen. All right, well, let's move on to our emerging issues with Gwen. Thanks, Michaela.
Hey, everyone. So behind the scenes, I have a new computer, so if I look like I don't know what I'm doing, it would be accurate. Kelly, can you put up the link to the advocacy opportunities? And I am having problems sharing my screen in my new setup. Could you share the document as well? This is a new acquisition about 2 hours ago. So anyway, behind the scenes, after the conversations you've had with the DCOs and you've had with board members and some additional requests, and then we talked with Ignatius around advocacy in the world of periodontal and dental. We also had some conversations with some other entity with Dustin Zimmerman, our OHA contact, and then some other folks involved in the dental world. And from all of those, we've compiled a list of different advocacy opportunities at different levels of organizations. So I'll go over these, and then we also drafted a couple of template letters that could be used for letter or public comment, rough draft. And so I want to share those with you so you know that nothing's been forgotten or dropped. There's stuff happening while you guys are focusing on the very important work of the community health projects. And then potentially see if there's one or two places that you all want to focus sooner rather than later, given the that you're also working on your the community health projects as well. So that's kind of what I want to cover in 15 minutes. So then we can move into planning for your combined meeting with the board. So I'm just keeping an eye on the time. On your screen, you see the compilation of different places that you could make public comment or written testimony to. There's a process behind that, which we'll save for another conversation. But the first page that Kelly's scrolling through right now is all through the Oregon Health Authority. The one that's coming up that I do want to draw attention to is the Oral Health Advisory Panel. They are specific around, obviously, oral health, and they don't meet every month. They have a meeting coming up in October 4th. And just because it's oral health and we're dealing with oral health, it's a really close tie for one of you to be present, sign up, make a comment. We can send letters as well, but I wanted to highlight that. Then as you continue to scroll down, there's a number of other places. There's the Medicaid Advisory Committee. They advise on the Medicaid program. So what's covered, what's not, services associated with it. And they're actually looking for new members, people who are on themselves on OHP or guardians of folks, on OHP. And they're looking for folks. This is a primo opportunity for one of you who qualify to sit on this panel and and impart your wisdom and your experience and really influence at the state level. And then finally, the last one is the Oregon Health Policy Board. So they are like the board of directors of OHA. So they're the boss's boss, if you will. Once again, they may meet regularly, and you can submit public comment. There's, as I mentioned before, there's some requirements around, deadlines for public comment, size, length, timing, all that kind of stuff, but we can, that we can handle offline for folks who are interested. Next page are, of course, our state legislature. So our senators and House representatives that are currently sitting. We know we're in midterms, and so this is going to change up. But I captured all the current folks who are currently in office, and this would be, it would be these folks that we could send email messages to, asking them to support funding for workforce development, funding for improved reimbursement rates, things like that. And then the last page, thanks, Kelly, are there are other state bodies that are probably working in the advocacy space within their own body. So one of them is the Oregon Dental Health Association. They have an Oregon Action for Dental Health. The Oregon Board of Dentistry also supports their profession within the state, and then the Ombuds program. These I have limited information. That's the next round of outreaches that I have on the to-do list to get more, start some conversations with these folks to see what they're doing within their work that we might be able to support. So hold that thought. The other creation that was made, Kelly, if you want to go to the template letters, these were rough draft. They are just a place to start. They can be tossed out, rebuilt, modified, whatever you all need. And if you can project that when you're ready, Kelly, that'd be great. There are 2 templates that can be modified, personalized. I focused them on the 2 main issues that you all are asking these people to address related to dental. And it's one, investing in the workforce. So train more, pay more, retain more in the dental periodontal world. And then the other one is around, you go ahead and scroll down, is around reimbursement for services, increasing reimbursement, because we learned that it's about a third, OHP reimbursement is about a third of standard reimbursement. And so these kind of follow a standard-ish advocacy letter format, and a place to insert your personal story of how it's personally impacted, because that's what this is really about. What people are looking for is, why are you, Teresa, why are you, Tom, talking about this? So I'm going to stop talking and ask for questions of clarity. If anybody has a place where they want to start and jump in, I'm happy to meet with folks offline to do that. And Teresa, I see you waving your hand.
So are these stored in Google Docs under the folder? Okay.
They are. So they are the links here. This is your folder. This is a Google folder that you all have access to, that you can go in, copy, paste, edit, make a copy and personalize it. We can help you with that as well. But these are your documents to work with.
Okay, so if I have Google Docs that I use for other stuff, and then I've noticed you have a folder there, are they automatically, when you set them, do they end up in my folder too?
So if you in your Google Docs, there should be, and help me out, Kelly, but there should be a place that says My Docs and Shared with Me.
Okay.
For you, because you didn't create the document, it's under Shared with Me.
Okay. Okay.
And it may be the whole folder that says CAC. It may be the document specifically.
Okay, cool.
Yeah.
Thank you.
Yeah, absolutely. Just know that if you write in the existing template, it'll save that way. So the template would turn into your personal document. Like if you put your story in, it automatically saves itself. So if you do want to use it, make a copy or a duplicate.
Okay.
The duplicate.
Oh, okay. Okay.
Yeah, and you can email, call, text, whatever, and I'm happy to walk you through that. That's what we're here.
Okay. You might have to.
Yeah, absolutely. That's good. Other questions so far about what you've seen, what I've shared?
Hey, Gwen, did you mention that last group that we met with? That's kind of reforming, used to be
The coalition, you know, interestingly enough, did I?
Oral Health Coalition?
No, they aren't, though. That's where we got a lot of these. So that's funny. My apologies on that.
That's okay. Could verbally mention it. I forget what they're going to call themselves, but it used to be the Oral Health Coalition, Oregon Oral Health Coalition, right?
Yes, yes. And then Mandy and I both signed up to be included in their emails, and we can add that to this list. They're doing some work and tipped us off to a number of these different places to also advocate. So I think there's more conversations to have with them.
And would you agree that seems to be the one organization that is really kind of advocacy oriented that we've come across? Like these other ones are, I mean, they can be advocacy oriented, but they're boards, they're committees, they're.
Yes.
This group is really, yeah, go ahead.
Yeah, like if we were, so with the OHA, we would be doing the advocacy as CAC or as an individual to anything with OHA. And same thing with the legislatures. If we want to join with other people already doing this work, then that would be with the, on that third page, partner with other state bodies, which should also include the dental coalition that we met with, that you and Mandy were part of. So, which we can do, you know, as well too. We can do all of these. Maybe not all at once, but.
Well, that's the problem with too much is it feels overwhelming if we, yeah, try to imagine somehow having a role in all of these or giving comment. But you could just write up comment or have something, you know, pre-written, and then deliver it verbally and just have it be the same thing.
Absolutely.
And get on each organization's agenda.
Yeah.
Or send it to them.
Yeah, absolutely. Yeah, I agree. Mandy, are you still here? You asked, do you have a list of the new district numbers for 2023 for legislatures? No, these are the ones that I pulled off the internet a couple weeks ago.
Okay, so I'm asking because at that meeting that Brad and I were at, they mentioned talking to legislators and candidates who have healthcare on their, as they're listed as their priorities. And so I went through the ones that I know of that are running and found one. She's running for District 53, which isn't on your list. So I think it's Rep Zika's spot, but I'm not positive, so don't quote me on that. But anyway, her website listed healthcare as a priority, and when you do the drop down box, she actually specifically mentions dental care. So I'm going to be meeting with her in about 2 weeks about all the stuff that we've been talking about these last few months with the dental care, and just putting that on her radar in case she wins her election. And I had something else. Oh, the other thing is that I've been dealing with the organization that is supposed to reimburse people on OHP when they travel and do all that fun stuff to get their services. I contacted them and they told me that I was supposed to make a reservation, therefore I will not be getting reimbursed. And so Kristen and I are working on that because when we originally started talking about that, that wasn't one of their rules. And so they're now going back on what they were doing and didn't notify any of the providers that they were doing that. And so I will do an update when we have something.
Yes, and I escalated that within Pacific Source because our writer's guide specifically says we don't have to have a reservation, if you will, or like we don't have to notify the brokerage ahead of time or the non-emergency medical transportation provider. So there's definitely been some like kind of internal discussions within Pacific Source. So hopefully more to come on that like in the next week or two. But a lot of people are like, yeah, this isn't right. So hopefully we'll be able to figure out a resolution.
So I'm watching time and we want to get to the next agenda item. So my question, I guess my first question is there anybody who'd be willing with, you know, preparation and practice, be willing to make a public comment and or submit written comment to the oral health advisory panel meeting that is the beginning of October? Thanks, Mandy. I see that you're willing. Anybody else? And it could be, it's all remote. We can work on drafting the email or the message.
Put myself as a maybe.
Okay.
I can find the time. Got to do the review of applications first.
Yes, I know. And we can make it as, you know, we can do a lot of the background work for you. So you just kind of have to show up and sit online for a little bit.
I'm with Brad. I don't know if I have time. I'm kind of already in debt of time.
No worries.
What are you asking us to do specifically? Go to the actual meeting?
So the way it works is staff, we'd put in a reservation saying, hey, Teresa has a public comment. We'd work with you to edit the template to put your personal story in there and make sure it falls within the word limit and time limit. Okay. And then you would get the email link to go on to the meeting. And there's usually like a 20-minute agenda item towards the end of the meeting where they take public comment. If they accept your public comment, then you can read what you're saying and they hear it straight from your mouth.
Okay.
So that's it.
Okay. So you have to physically be, well, Zoom be there.
Zoom be there. Yeah. I think you can also do by phone. You don't have to be Zoom.
Oh, okay. Well,
but Gwen, can't you also just submit written comment?
You can do that as well. Yeah. That can happen anytime.
You don't have to be present.
Yeah.
It tends to be more impactful
if
you speak directly to the people, but you don't have to. Yeah. The other thing that I want to throw out there is because I started doing it because I went to the dentist a couple weeks ago. And I just want to encourage people to talk to your dentist or your hygienist, whoever it is you're interacting with, to ask them if they serve OHP members, and if not, why not? And then just listen, see what they say, and then maybe follow up after that, if you want to or not. But and then bring that back to the CAC. I think it's interesting to learn from the provider perspective why they do, why they don't. Because that's really, we need more providers. That's a big part of the problem.
All right. So right now, I have Brad and Mandy as possibilities for written and or physical comment for those. Teresa, you're raising your hand.
Yeah, I think I could pull it off.
Your game. Okay. So I'll reach out to you and we'll do what we can do. Excellent. All right. So we're going to put a bookmark in this and come back to it in not next month because it's community health projects, but in November. So, and we'll continue to work on, other places where that public comment can be used using the letters that you guys are creating for this as well. So thank you, everyone. It's kind of fun to see it moving along and see all the places where you can influence with persistence. All right, the last agenda item is around the board and CAC combined meeting. So historically, every year, the board of directors and the CAC have come together to 1, be together, 2, build relationships, and 3, work on something together. Last year, this time, when the CACN board did that, they said, hey, we want to meet, you said, hey, we want to meet together more than once a year. And so we started doing that this last year. We've met probably 3 times combined to build that relationship, get to know each other, start to find where there's something you all can work together on to really build that symbiotic is the word that comes to mind, but that building on each other relationship around something that's super important to OHP consumers. So we have another of those meetings coming up. It's going to be in November. And we, the staff, want to know what is important to you as CAC to work with the board on. What do you want that meeting to look like? Kelly, could you show the slide? A year ago, when you all met with the board, with the consultant to say, hey, these are our priorities, our priorities for CAC and the board. This is what you, where your priorities were. The first was the joint meetings with meaningful, purposeful agenda and dialogue. The other first priority was patient stories, focusing on reality. And then more quantity and quality of interactions. And so I'll let you read that. So thinking to November, thinking you all will have maybe an hour and a half together with the board, thinking about what you've done in the past with the board so far. I want to ask a couple of questions just to help center the conversation. So first question, go ahead and take that down, Kelly. What do you all remember? Just 1 or 2 things. What do you all remember from the last few times you've been together with the board? So just take yourself off mute and share out. What's a couple of things that pop to mind that you did, or things that you remember from previous times with the board?
I guess kind of a simple thing is just getting to know the board members and just, you know, interacting with them. And sometimes that can lead to some conversations around things that the CAC are working on.
Mm-hmm. That personal interaction. I know we had some get to know you questions and a lot of small group time, and just the interpersonal, get outside the suits and the titles kind of thing. What's one other thing you all remember from the times together? Connor, Miranda, Elizabeth, I'm going to invite you to share and recall.
When I think it's the memory thing, the memory, the COVID memory fog. I'm in trouble too. Like, searching for the agendas. Like, what did we talk about? What did we do?
So a lot of personal time. I remember the conversation with the DCOs was with the board. Am I remembering that accurately? Oh. All right, so next question as we get to the agenda planning. When you think about continuing the relationship with the board and working on something together and getting that building the interpersonal piece and working on something together, what excites you about thinking about that? 1 or 2 things.
This is Miranda. I think what kind of excites me is like just in general, that relationship building and how those other kind of like just natural conversations come up that typically leads to something else in a bigger discussion or the more kind of networking. And I find that usually those conversations, I usually have something in contact that you can take back to your own programs or, you know, use in the future.
Thanks, Miranda. Yeah, there's a natural flow that happens.
From my perspective, both the board, because I sit on the board and I sit on CAC, I think the board is struggling with how to meet CAC's needs and even to identify what the board's needs are in relationship to CAC. I mean, we have the general purpose of the board wants to be informed and needs to be informed of the real member experience in order to guide policy. But beyond that, what does that really mean? And then the board wants to help CAC, but from my perspective, CAC hasn't been as articulate as we could be, or if we were to ask beyond dealing with issues like the dental access or what's in the plan or whether we're culturally sensitive or not, what does CAC as a group really want and need for us to be able to perform better from the board? And so I'm thinking if we can get a little clearer about that, we can be more clear with the board about what we want and need, whether that's training or interpersonal relationships, whatever it is. And then the board can be clear about, oh, you want that? Let's see what we can do to rise to the occasion.
Mm-hmm. What are our other thoughts on what Linda said about identifying what y'all want and to help with that connection?
I like the idea of the board supporting us in this dental access. Like, I know it's good to come from the source and the people that are affected, but to have a board member say, hey, you know, I'm a board member that works with this CAC and this is what we're hearing. And I just want to support, you know, the advocacy efforts so that people on OHP are treated fairly and get the services they need or something like that. I think that's a good idea, Linda.
I see you leaning in, Teresa. Oh, you're muted. I'm sorry.
I would really like to see the community health projects go off our plate.
Okay.
And I would like to see the time spent really looking at patient care. Because again, when I started, I know I'm not the only one, and we've made progress with dental, but not much, given it's been over 2 years. So I feel like the CAC should really be about patient care. What are they getting? Why aren't they getting it? And what I'm discovering, and this is just based on me listening to people say things, drawing my own conclusions, is like, for instance, with teeth, I feel like unless the tooth has a long lifespan, which is 5 to 10 years, then we're just going to pull it. This tends to be the attitude for OHP, because that's the only way we're going to cover it. And I'm like, you know, that's not fair, because I could be dead in less than 5 years. Probably not, but that's not fair. I mean, so I just start feeling more and more and more like I'm just a number. I'm not a person. And I think that I feel like the CAC was established to really help the members get the best service. And I feel like we just get pulled too many directions, and that takes up a lot of time. So that's my personal opinion. You can disagree with me, but it just seems like it should be about the people. And that's what I'd like to see for them. I know they're an organization, they have to do X, Y, and Z, but it needs to be about the people, even though they're poor. Or we're poor.
Because they are, yeah. Yeah.
Okay, I'll shut.
No, that's great, Teresa. Thank you. Thank you. So I've heard, considerations for board supporting the dental and periodontal work that you all have started focusing on patient care, and then continuing to build those interactions and personal relationships. So everybody's more approachable and some of that spontaneous connection can happen. What else comes to mind? And which of those might be more important than the others if you had to prioritize, an hour and a half?
Gwen, what I also heard articulated was that it would be great if the policy issues, which ultimately relate to what people experience as patients, if those policy issues, that what CAC would like is for the Health Council to be an advocate for those at other higher levels with the state or whoever.
Thanks, Linda. Other pieces that I missed or want to be added to?
I want to piggyback on what Teresa said. This isn't necessarily in relation to the board, but I would love to be able to advocate for more folks than just myself, but I don't know anybody in my immediate circle that's having issues. So what about some kind of training on like how to get out into the community and get those stories? Because I'm not going to just go knock on my neighbor's door and be like, hey, are you on OHP? Want to share your story? But if there's a way to get more of those issues to us that we could advocate for, I would be open to that.
That's good.
Or even like a little card that providers that serve OHP could put in their office, that says, hey, this group represents you if you have issues, just, I don't know, just throwing stuff out there, but some way to get people to be willing to share those stories and bring them to us in our communities would be awesome.
What are great ideas. Closer to the community, closer to the board, closer to the policymakers. So we have 3 minutes. So if you had to prioritize those four things that you've heard, those 4 concepts for this meeting, not that we want to, but say we're pressed for time and there's other things that need shared focus and energy, which of those would you want to start with or want to prioritize in your time frame?
Gwen, could you repeat the 4 things?
Yeah, what I have in my notes, so folks chime in, are working with the board a little bit more clearly on focusing on patient care and advocating for patient care, which would include reducing community health projects, the relationship development, just the interpersonal stuff, having the board and CAC work on policy issues related to patient care, training for how to get more stories from the community for CAC to help advocate for, and then continued work on dental and periodontal work with the board. Yeah, I know, huh?
Hard to keep all that in the brain.
I know.
The board was clear about, I have in my notes from when we met or I don't know when this is from actually, I think our time with Ignatius. I'm not exactly sure, but we want to understand the consumer experience and how to deliver care better. Are we meeting the needs? I kind of highlighted those points. So however that time can be structured. And I do feel like we are, I'd like to hear from others, but I feel like we are, we could do a much better job at engaging the consumers in the CAC process and the board's process. You know, we're a small group of consumers, small representative, or not representative of all consumers, Medicare members, but Medicaid members. But yeah, I think we need to do a better job at that. And so I think it'd be interesting to hear from the board, like, what is, if we were to like knock that out of the park, what would it look like? If we were to do a great job of helping them understand the consumer experience, how to deliver care better, and whether or not they're meeting the needs, what would that look like?
Thanks, Brad. All right, so what we'll do is we've got a couple months until the November meeting. And I know board has some things, so staff will work on a draft agenda and integrate these asks and desires into that agenda with Carmen and the board chairs. And then we'll share back with you as things start getting worked out, so you know what's coming. And I know this, for me, this feels unfinished. Okay, so what are exactly we talking about? What's going to happen? So I want to acknowledge that and know that it's going to continue to build, and you'll be part of that conversation as we get to that November meeting. We'll keep you abreast as the agenda comes together, but super helpful. Really excited about the energy that you all are drawing on and bringing forward. So, Michaela, anything you want to finish up the meeting with? Sorry. Okay, Linda, go ahead.
The thought that I love this conversation. What's just occurred to me is a question that I don't really know, which is beyond patient complaints, and I know there's a process through Pacific Source with that. How does a provider know whether they're hitting the mark or not in terms of client satisfaction, particularly with OHP clients?
At least for dental, and I'm anti-surveys, and that's my personal opinion. It's a long story, we won't go into it, but they send you out a survey. Did you get this? But it's really not about it. It's more, was this service provided? Did you pay for it? Were you reimbursed? So it's really not about the dental care. But I'm also have a different story, a little bit story. Based on my story, I ended up with an advocate. So she does ask me, but she also only asks me once in a while, because advocates, even though you have them, they really only talk to you when you have a complaint or something. Their caseload's too big. That's the reality. So I'm guessing, in theory, again, on paperwork, it might be looking like it's happening, but it's probably not happening.
Well,
You know what I mean?
that might be a subject for a common conversation with the board. If the
Yeah.
board wants to know how they're doing, or the health providers want to know how they're doing, but we don't have a mechanism in place, and we have clients and patients who know that where it's missing the mark, what can we do to get that information back and forth?
That's a good point. Seemed very big and out there, but hopefully they would care. Not the board, the physicians. And again, most of the physicians I've ever come in contact with genuinely care. They just don't have time.
Or they don't have access to the data they need to do something different.
Mm-hmm.
That's my closing thought.
Thank you, Linda. I want to thank you for staying on as you're